This conference will now be recorded.
Right? Okay.
Good evening, everyone, and thank you to this edition for Medicare 101, Understanding Your Medicare Options. My name is Michelle Brooks. I am one of the licensed agents here at OC Federal, and we'll be going over some basic facts today having to do with Medicare. This is an interactive seminar, so if anyone at home has any questions, please feel free to type them in, and we do have someone manning the line, so we'll get your questions answered as soon as they come in. With me, I do have Kelly George. He'd love to say a few words about himself in the program, just to kind of kick it off, and we will get started shortly after that.
Well, my name's Kelly George. I'm the sales manager for Ohio CU Financial Services, and we're here tonight to learn about Medicare. I'm excited to help you folks. A little bit about my background and the background of the program. I'm an insurance agent, an investment advisor, accredited investment fiduciary. Michelle is a finance consultant and licensed insurance agent. We have licensed agents in each of the branches that can help you with your Medicare options. And a little bit about the program. The credit union set up their own financial service program. It's called Ohio CU Financial Services. So it's not an outside firm coming in, it's their own program. I'm an employee, Michelle's an employee. I've been in the insurance financial service industry for over 30 years. And one of the credit union cares about your well-being. And the one way they care about you is to help educate you. So we've had seminars on estate planning. We've had seminars on other Medicare options. And you'll see more education events going on. And this is to help the members so they can make informed decisions. So our goal here is to help you understand Medicare, and you can make informed decisions. And then if you need our assistance beyond this, you could sign a reply card or have us help you to choose your plan. We work with all the national providers, and we welcome you. And Michelle's going to go over the presentation. And again, if there's any questions asked, because it's overwhelming. There's just a lot of information. You're both aware of it. So with that, we'll go ahead and start the program. Is that correct?
Yeah, feel free to stop me at any time if you have any questions or concerns. Alrighty, Medicare 101. Alrighty, who is eligible for Medicare? Okay. Ways to become eligible. If you are 65 and or older, if you're under 65 and receiving Social Security disability or SSDI payments for more than 24 months, you are automatically eligible. If you at any age with end-stage renal disease, you are also eligible, and you must have qualified residency for 5 consecutive years.
Trivia real quick. Who was the first person to ever get a Medicare card? Anybody know? President Truman. FYI. Useless information. But go ahead.
Okay. Medicare enrollment. If you have Social Security when you turn 65, you'll be automatically enrolled into Medicare. You'll receive your Medicare card 3 months prior to your birthday. If you do not have Social Security when you turn 65, you'll need to take the step to sign up for Medicare. You can sign up through ssa.gov, call Social Security, or apply at your local Social Security office. Medicare basics. Alrighty. So original Medicare is Part A, which is your hospital insurance, Part B, which is your medical insurance. You then have the option to purchase additional coverage. You can do a medical supplement and Part B, or you can just do Part C along with Part A and B, if that made sense. So again, original Medicare is Part A and B. You can then have 2 choices. You can sign up for a supplement plan, which is your Medicare supplement plus a Part B prescription plan, or you can sign up for Part C, which is a Medicare Advantage plan. Original Medicare Part A, hospital insurance. What this is going to cover is inpatient hospital care, skilled nursing facilities, your hospice care, and some limited home health care. Part A costs. Eligible and paid into Social Security for at least 40 quarters, you're not going to pay anything for Part A. Eligible and paid into for at least 30 quarters, it's going to be a reduced cost at $285 monthly. And eligible and paid into for less than 30 quarters, you're looking at a full cost of $518 monthly. If you don't qualify on your own, you may be eligible based on your spouse's work history when you turn 65.
And what is a quarter? What is that based on?
Social Security.
Oh,
They don't so much on that. Well, what if, like I've got 40 quarters, my wife won't have 40 quarters, so where would she fall on that to pay?
Like, would she be eligible for your full 40 quarters? Is what you're asking?
Well, I assume she could.
Well, let me address this. She works for STF. She's been a teacher for her whole career. STF. She paid up. Is she on the state program?
Yeah, she's on, well, she's going to have like 18 years in of STRS, and she's got like 3 years of Social Security.
Okay. So they changed. Well, she'll be eligible for Social Security when
Right,
she's,
right, I know that.
and they'll calculate and let you know in regards to Part A if she has to pay, because she probably will not.
Okay.
There's a formula with the state of Ohio versus the paying in Part A and B.
Okay.
So again, we can research that for you too.
Good question. Original Part B medical insurance. This provides coverage for doctor's visits, preventative services, outpatient surgeries, diagnostic screenings, emergency care, and durable medical equipment. The cost. Part B premium is $185 each month or higher depending on your income. You'll pay a higher premium if your income is more than $106,000 if you file an individual or are married and filed separately, or $212,000 if you're married and file a joint tax. One moment, we have another participant coming.
But just FYI for you about your wife, will she retire after 18 years or 2 more years? She gonna be there?
What was it? She's got 7 years to go.
So just want you to know that when she does retire, the state has plans for the teachers.
All right.
Yeah, and they usually give you a subsidy or something.
But let's see what's
Okay. Part B, your late enrollment penalties. If you did not sign up for Part B when first eligible and not covered by a creditable employer plan, you may have to pay a late enrollment penalty for as long as you have Part B. Monthly costs may go up 10% for each full 12-month period that you could have had Part B but did not enroll. Exception, you do not have to pay a late enrollment fee penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. Original Medicare generally covers 80% of your hospital and medical expenses. Original Medicare does not cover deductibles, co-pays, co-insurance, outpatient prescription drugs, healthcare outside of the United States, hearing aids, exams, screenings, routine and eye exams, and most classes. It also does not cover routine dental exams. All right. So this is one of the additional coverages you can opt for. This is Medicare Supplement. You might have also heard it called Medigap. It can fill some of the gaps that original Medicare does not cover. It can cover your deductibles, your co-pays, your co-insurance, freedom to choose any Medicare appointed doctor in the US, standardized plan letters with associated services, and it has a monthly cost and will vary based on the insurance company. Medicare supplement plans do not cover prescription drugs. Drug coverage can be added separately, a prescription drug plan or other creditable coverage. Okay. Part D. Part D is your prescription drug plan. There are two types of Part D coverage. There is a standalone prescription drug plan. You must have original Medicare Part A, Part B, or both. And as a part of a Medicare Advantage plan. Medicare Advantage plans must include Part A and Part B coverage. Part D coverage covers some prescription drug costs. You must continue to pay your Part B premium if applicable, and you must live within the Part B's planned service area. Okay. This as well has a late enrollment penalty. If you did not sign up for Part D when first eligible and did not have credible coverage for more than 63 days, you may have to pay a late enrollment penalty for as long as you have Part D. The penalty is 1% of the national base premium, which was $36.78 in 2025, multiplied by the number of months you were not covered while eligible. For example, the national base premium was at $36.78. If you signed up in 2025 after missing 10 months, your monthly penalty would be $3.70 per month.
So you have to sign up for Part D?
You have to sign up for Part B once you're eligible and didn't have any other, and if you did not have any other coverage. So if you're still covered under like your employee sponsored plan, you have coverage, you don't have to worry about a penalty. But if you did not, and you were just late with enrolling, then yes, that would apply.
And that goes on
Forever.
All right.
That's
So
incredible.
to clarify that, look, so if you have credible coverage, if you're on your spouse's insurance and you just received a Medicare card of A, and then your Part D, the credible coverage would be your spouse's employer or yours. So everyone doesn't retire at 65. You don't have to worry about not having a prescription drug card because you have credible coverage. Okay. If you have Medicare and you apply for Medicare, that's Part A and B, you always have Medicare, and you apply for Medicare and you're on Medicare, you have 63 days to sign up for a standalone drug plan or have some type of drug plan, or you're going to be penalized once you have Part A and B.
So basically, I do have to sign up. Even if I take no drugs,
Yes.
I have to sign
Yes.
up.
Right, and there are people says, I don't use medications,
Yeah.
why do I need to take this? Well, the system will penalize you if you don't have some type of credible drug plan when you're on Medicare Part A and B.
Mm-hmm.
But
You
some
have to
plans
say
include,
you need drugs.
right, yes.
Exactly.
And that's, how much is that a month?
Well, it's increased for every month. You go ahead and show.
Yeah, so in
Like,
this,
I mean, if I sign up for day one,
if you sign up for day one, the national base premium is $36.78.
Or you want how much is the penalty or just how much is the drug plan?
I think he was asking the drug plan.
Okay.
Am I wrong?
What was your question, buddy? What was your question about that here?
well, if I sign up from day one
Mm-hmm.
On Medicare Part A and B.
Part D.
for Part A, Part B,
Right.
I have to sign up for Part D right away,
Mm-hmm.
Within 63 days.
the same thing.
Mm-hmm.
And I was asking, what is the cost
Yeah.
for Part D?
Mm-hmm.
Okay.
Is that that
So
36?
that's not the penalty. The cost for Part D, depending on if you get a standalone drug plan to work with this Medicare, it could be $50 a month up to $150. It could be, all depending on what plan you get. That's if you get a standalone plan.
Mm-hmm.
50,
Right.
So it'll vary. They just use the national base premium.
For penalties. Yeah.
Your prescription drug costs change based on the coverage stage you're in. So there are a couple different stages to the prescription drug costs. Stage one is the deductible. The amount you pay before a plan covers your prescription drug cost. So that's going to be $0 to $545. This could change in 2025, but this is all the information we have for now. Stage 2 is the initial coverage. The plan pays its share of the cost, and you pay your share, co-pays and co-insurance. The maximum out-of-pocket cost is going to be $2,000. And stage 3, the catastrophic coverage. After you reach the maximum out-of-pocket, the plan will pay for your covered drug cost for the rest of the year. There's no copay, co-insurance for covered drugs for the remainder of the plan year. That makes sense, Mike?
No, it doesn't. Maybe you're gonna have to figure it out.
Well, you have, let's just say, if you had a drug plan, let's just say you have a $500 deductible. So you would pay out of your pocket if you went to get some prescriptions, up to $500 if you have a deductible. After that, it ticks into the insurance where you may have a copay, you may pay $0, the plan pays $100, and then if you spend up to $2,000 on the drug plan, then you go to $0, then your drugs are all covered in a calendar year. Some plans don't have a deductible, some plans do. They're all different.
So in the first stage, you're definitely paying out of pocket. Second stage, you're probably paying out of pocket. And the third, you're good for the covered drugs.
See the bottom there, it says deductible range. It can be $0 plan or $545. All depends on what plan you get. So you know.
If you meet certain income and resource limits, you may qualify for extra help from Medicare to pay the cost of Medicare prescription drug plans, Part D. You can apply at ssa.gov. What they do is they count your assets, including money in a checking savings account, stocks and bonds, but they don't count assets such as your home, one car, your burial plot, up to $1,500 for burial expenses if you have put that money aside. They don't count furniture or other household and personal items. Alrighty, Part C. This is going to be your Medicare Advantage plan. Medicare Advantage plans are offered by private insurance companies approved by Medicare, and it is an alternative option to original Medicare. You must continue to pay your Part B premium. So your Part A, your Part B, and your drug plan all put together make up Part C. Dual eligible special need plans, DSNAPs. If you're eligible for both Medicare and Medicaid, you may qualify for plans with additional benefits not covered by original Medicare. You may also receive cost sharing assistance. If you are enrolled in a DSNAP plan, you are also eligible for a special enrollment period during these times, January through March, April through June, and July through September. During these times, you may join, switch, or drop your Medicare Advantage or Medicare prescription drug plan. You may also take a change during the Medicare Advantage annual enrollment period from October 15th through December 7th. The enrollment periods. All right, so there are several different enrollment periods. First is the initial enrollment period. So this is per the individual. It's 7 months total when you're turning 65. The election period is 3 months before your birthday month, and then the 3 months after your birthday month. So you have a total of 7 months. There is a special enrollment period. That is a special circumstance within the calendar year. So if something happens, like you move out of a service or you move out of a specific area which your plan covers, or you are no longer working at your employer, something like that, which requires a special circumstance, you would get a special enrollment period.
Coming off of group insurance.
Medicare Advantage has an annual enrollment period of October 15th through December 7th. and has a open enrollment period of January 1st through March 31st. Medicare,
Can I jump in?
yeah,
So the October 15th to December 7th, you can get into a plan then if you don't have a plan, or if you have a plan and you want to change it, that's the open window. You can change different plans. That's what that's about there. And then the other area, if you go back one,
yeah,
the open enrollment period, if you went into an Advantage plan, for example, and you were not happy with that plan, let's just say you went into a Humana plan and you weren't happy, you can go to another Advantage plan before that date's over, March 31st. So you're not locked in for the year. Okay.
Medicare supplement enrollment period is a 6-month window. Okay, is a 6-month window that begins on your Part B effective date or 65th birthday, whichever is later. There's no medical underwriting during the initial 6-month enrollment period, and you can choose from any Medicare supplement plan. Medicare supplement guaranteed situations. There are several other guaranteed issue situations to enroll into a Medicare supplement plan with no underwriting. For example, loss of coverage, moving to a new area, and many more. All plan options may not be available. If you do not qualify for guaranteed issue situation, you may need to undergo medical underwriting.
Can I jump?
Absolutely, please.
So the Medigap, Medicare supplemental, those are for insurance contracts. Those are the alphabet plans. You hear people, I have the F plan, the N plan, and this plan. So when you're first initially available to get in the plan, so you're on Medicare A and B and you want to have a Medicare plan, you can enroll without a guaranteed issue no matter what your health condition is. And they don't rate you. You're going to get the same rate as everybody else in that area. If you don't do that, then you try to go back in later after that fact, then they could underwrite you based on your health.
To get a physical.
Well, meaning that they're going to look at your medical records and they're going to say, okay, we're not going to charge you $150. We're going to charge you X amount because of the underwriting.
Or they could decline.
So that's one of the advantages of guaranteed issue. You know, so those kind of things we bring to the table when we're helping members. Go ahead, Michelle. Sorry.
No, of course. Star ratings. Each Medicare Advantage and prescription drug plan is assigned a star rating from 1 to 5 stars. And it's where they get the stars from. It comes from member satisfaction surveys, plans and providers, performance measurements based on a 40 key factor. And if you want any more information on that, it is available on Medicare.gov. My service to you. You may have you have many options for coverage. Continue with your employer plan if you're still working for an employer with over 20 employees. Continue with your retiree military plan if applicable. Enroll in Part C Medicare Advantage plan, which can include Part D coverage, prescription drug coverage, or you can enroll in Medicare and a Medicare supplement plan and a standalone Part D prescription drug plan. During your appointment, we'll review your needs to help you find the right plans for you to choose from. General questions you may want to ask is did your Medicare start? What zip code do you live in? Do you have a primary doctor? Do you have a specialist? Do you take home any medication, or do you take any medications? And are you looking for a certain service? All right, so ready to find the plan that fits your needs or have any Medicare questions? We're here to help. Again, my name is Michelle Brooks. We have Kelly George. We are willing to go to any of the locations to meet you. We will also make home appointments. I'm more than happy to do that. My number is on the screen if you're at home, and then I'll make sure you guys leave with my name Kelly's card. So if you have any other questions, concerns, we'll be more than happy to talk to you more in depth. People at home, you're also going to get an email just letting you take home a recording. this meeting was recorded, so you'll get a copy of the recording. You'll also get just like a feedback card. If you want more information, you can fill that out, and we'd be more than happy to get back with you that way as well.
So I wanted to mention also, so when it comes time for Medicare, again, you may have an idea of what our goal is that you have an idea about Medicare Part A and B and what plans will work, et cetera. But there's a whole lot more involved in that, like where, if your spouse works for the state, et cetera. So we bring to the table, get some information to assist you and again, go over Medicare so you'll have a good understanding of Medicare Part A and B, and then look at what your options are. So we have the technology that we can take your medications, your doctors, your primary care, et cetera, get more information from you. And based on your needs as you're learning along, you say, okay, based on your needs, here's a plan that may be appropriate for you, or this plan, or here's the cost, et cetera. So this is just a basic idea of, Medicare 101, but there's a lot more in there. And once you learn it, you understand. It's like riding a bike. You have an idea. But we're here to help you. We have a business reply card that you can give us permission to reach out to you if you want. You're not obligated, and we can help you. And I recommend if somebody does want help. We're getting ready to come into the open enrollment season, so if you do need help, of your choice, I would kind of get the ball moving here if you want to. That way we can help, because I think the trend, with the credit union, every time we have some event, there's more and more people are starting to call because they're finding out that the program is available to help. But again, you're under no obligation to do that. But we want to help you, and again, and this is just a program that really helps the members. Even if you took the information and you went somewhere else, that's okay. Everything doesn't have to be about making a sale. It's about helping the members. So that's our story, right?
That's our spiel. Thank you all at home for joining. If you have any other questions, please feel free to reach out. My email is also on the website. Thank you very much.
Questions? Any questions for us?
Why